is Stanislaus, and I'll be performing my redem for oral medication today. So before I start, first I'm going to do is clean up my workspace. Then after that, sanitize my hands. Then I'll go through his medication for today just to get familiar with the medication that he's having this morning. So my patient is Milton Joe, and he's having risperidone 2 milligram this morning, and he's taking 1 tablet. Then he's having amitriptyline 25 milligram, and he's taking 50 milligram. That's 2 tablets in the morning and in the evening. So go through the medication drawer, and it's my first check getting his medication. So this is risperidone 2 milligram, which is risperidone 2, and amitriptyline 25 milligram, and yeah, that is correct. So that's my first check. Then prepare his medication using the 10 rights of medications, which is first the right patient. So I have Milton Joe here for risperidone, and also Milton Joe here for his amitriptyline. Then the right drug, which is risperidone here, and this is amitriptyline here. The right dosage, and the right dosage for risperidone is 2 milligram. It says here on the container 2 milligram. And for amitriptyline 25 milligram, he's taking 50, so it says here 25 milligrams. So I'm going to give him 2 tablets from this. So that's the right dosage. The right time is 8 o'clock in the morning, and that's when it also says on the mark sheet 8 o'clock in the morning. The right route, so he's having it orally, and this is in tablet form, so that is confirming the right route. Then the right education, so when I get my patient best, I'm going to ask if he has any questions for me. Then the right assessment, which I already done, he needs his medication this morning. Then the right evaluation that we have to have done, and the right documentation that will also be after I'm done giving me his med. Then prior to dispensing his medication, I'm going to open the medication cap, the cover, and dispense the medication into the cover. But prior to doing that, I will check the medication. That was my second check. So it's risperidone 2 milligram. So I'm doing the risperidone 2 milligram into the cover, then into the medication cup without touching the medication cup to avoid contamination. So I have his risperidone 2 milligram. Then prior to putting it into the medication drawer, I'll do my third check. So that's risperidone 2 milligram, and I put it back into the drawer. Then I go over to amitriptyline 25 milligram. Yes, and he is going to have 2 tablets because he's taking 50 milligrams. So I open up the cap and I pour it into the cover of the medication, then dispense it into the medication cup, then cover it. So I confirmed it was amitriptyline. That was my second check. Then my third check before putting it into the medication drawer, I confirmed it was amitriptyline, and I put it into my medication drawer. Then after doing that, I sanitize my hands before going to my patient's bedside, then going with my more and my medication cup. Hi, Milton Joe. How are you doing this morning? Before, can you tell me your name and your date of birth?
Milton Joe, July 15, 1963.
Okay, can I just check your wrist for your date of birth? So I'm checking my patient's wrists to confirm his name and his date of birth. So before that, I'm giving my patient his medication. So here's the medication this morning. My patient has taken his medication. How are you feeling?
Good.
So I've confirmed that he has actually swallowed his medication. So do you have any questions for me?
No.
Alright, thank you, Milton Joe. Then I leave the room back to my working station. Then I sanitize my hands. After sanitizing my hands, then I document my initial on the mark sheet. So my initial here on the mark sheet at 8 o'clock. So after doing that, I am done with my oral medication. Put this back into my patient's file, then sanitize my hands, and I'm done. Thank you so much.